Hi, I'm Mandy Kenny and I'm a Professor of Rural and Regional Nursing based in the La Trobe Rural Health School in Bendigo. As an undergraduate sitting where you are now, I remember being totally bored with research type subjects. I wanted to be a nurse and midwife and couldn't see the relevance of learning research. Epistemology and ontology nearly did my head in. So how did I get from someone who thought research subjects were a waste of time to now a passionate researcher? For me, the term research in my undergraduate studies totally bored me. It felt like something quite foreign and divorced from the reality of practice. I was a pretty good nurse, could manage most clinical skills competently, could do a pretty good assessment, and managed not to do too much harm to anyone. But as I completed the assessments for those boring research subjects, I started to see beyond the confusing research terms and thought much about evidence. Yes, I was a pretty good nurse, but did I always know what the evidence was to support my decisions? Did I fully understand the experiences of the people that I encountered? The turning point for me was when I realised research was really a term for problems. Methodology was the principles and rules for solving problems, and methods the tools and processes that are available for us to use to solve problems. Breaking it down in that way removes some of the mystery of the research process. In my early research career, I was naturally drawn to research from the interpretivist and critical paradigms. Paradigm, another word that nearly did my head in. But a paradigm is simply a way of looking at the world. When I started as a researcher, I was interested in people's experiences and the way in which those experiences intersect with how I view people, situations, the world and myself. So I started my research career firmly embedded in the interpreter's paradigm. I had little interest in numbers, control and prediction. I remember working with a group of GPs and encountering many young women with really severe cyclic abdominal pain. Many of them would tell me heartbreaking stories of being seen as malingering and lazy. They would describe having horrendous pain and would be put through 1 million invasive procedures to rule out diverticulitis, chlamydia, ectopic pregnancies, pelvic inflammatory disease and urinary infections. Many were simply told that they were quite pathetic and there was nothing at all wrong with them. One evening, I had this fascinating discussion with a young woman who told me the long story of her going through a multitude of invasive tests before someone finally thought maybe she had endometriosis. I was surprised because I thought that would have been the most obvious thing to consider in a young woman with those symptoms. I chatted to some colleagues and then did a bit of reading and found that the average time from symptom emergence to diagnosis in endometriosis was often years. We did a very small audit and found that our diagnostic rates were around that time span. Maybe numbers weren't that bad after all. A few years later, I had a student who did a small honours project on women's experience of endometriosis. The delayed diagnosis was a common feature, but so too was the abusive boyfriends because having sex caused these women lots of pain, the job losses because they had so much time off work, and the battered self-esteem caused by people telling them that they just had women's problems and should toughen up. Yes, the time from symptom emergence to diagnosis was important, but it only told half the story. My PhD work that I completed more than a decade ago developed my skills in mixed method research. I worked on a funded project from the Victorian State Government that aimed to design a new funding model for health service emergency and outpatient services. I learnt so much about funding models, the economics of health and health policy. I could see the value in logic, hypotheses, verification and generalisability. Whilst I didn't see that positivism could solve all of the world's problems, I did see a place for intervention studies and randomised controlled trials. However, I view stories as incredibly powerful, so I'm at heart a qualitative researcher. I do not accept the historical, pure, positivist view that the only valid knowledge is scientific. Knowledge that can be replicated, where the role of researchers is to distance themselves to ensure that bias is minimised. I am absolutely fascinated to understand human behaviour, why and how people do things, and why and how things happen. Yes, the what, when, where, and how many is important, but our knowledge can be so much richer if we bring different approaches together. As my research career has developed, I've become much more interested in mixed method research, and much of my work has become naturally aligned with participatory methodologies. My natural inclination is to the social sciences. This doesn't mean that I reject surveys, interventions and trials. We use these frequently in our research. Rather, I feel my research interest is now much more influenced by the critical paradigm, the worldview that knowledge and reality is influenced by the social, cultural, ethnic, gender, economic and political factors that impact upon people and the world in which we live. You will learn about prediction and control and all of the various approaches to qualitative research. You will be exposed to grounded theory developed by two sociologists, phenomenology, which is focused on experience, ethnography, which in its simplest form is about the study of people and cultures. Hopefully, you'll be exposed to the newer visual and digital methodologies that are rapidly being developed as our world becomes so much more technologically driven. However, whilst you might think about your subjects as nursing research, I would challenge you to think about whether the term nursing research should be used at all in contemporary society. I don't mean that nurses don't do important and valuable research that should be recognised, but that our focus should be on healthcare research, where nurses are important members of the multidisciplinary team. We ardently promote multidisciplinary practice, yet there's still textbooks being produced and used titled Nursing Research. In the same way, I would like to challenge you to think about research methods in a different way. Typologising different methodologies and methods into discrete boxes with certain labels is incredibly useful to teach people in a very structured way in a crowded curriculum. The risk, though, is that people learn very structured, boxed methodologies and methods and lose sight of the fact that the very best method is the one that answers the research question. One of my personal bugbears is that people develop research questions and aims in such a hurry, with their major focus on the methodologies and methods that will guide their data collection. As you read the various research articles that you're required to focus on, please focus on that research question and the aims. Ask yourself, what is the best method to answer that particular research question? And could greater knowledge be obtained by combining different methods? I think there is general agreement now within the research community that the problems that we face and the questions that we want to address require many different ways of looking at the world. A few short decades ago, purists would tell us that mixing paradigms, methodologies and methods would create untold damage to the rigours of research. I think that view is really changing. We're having great fun with our current research. I manage a number of research projects, but our Rural Echo study is producing the most fantastic grassroots outcomes. The Rural Echo study is funded by the National Health and Medical Research Council, two Medicare locals, Dental Health Services Victoria and the Royal Flying Doctors Service. There are sociologists, social science researchers, public health researchers, doctors, dental and oral health experts and nurses involved in the project. We attracted almost $1 million for this study, and it is being conducted across Queensland and Victoria. Our aim was to identify whether a focused process for engaging communities could improve oral health outcomes amongst rural people. The driver for this study is the evidence of poor oral health outcomes amongst rural people and the strong link between oral health and conditions such as heart disease, premature birth and Alzheimer's. The study is heavily influenced by the critical paradigm, and we use the cyclic action research processes of planning, action and reflection, but we also collect a lot of quantitative type data through surveys and questionnaires. We are interested in links between participation and health literacy. We are about halfway through the project and have collected a wealth of data. But probably the best outcome from the study so far is the way in which communities are driving the work. The introduction of a toothbrushing program for kids in one community has developed strong ownership by people within that community. They needed to devise some way of storing the toothbrushes in schools to run the program. It was really expensive to buy the off-the-shelf product, but the community worked together to create great storage containers really cheaply. A trip to Bunnings for some plastic containers and a couple of drills. We are collecting great research data, but it is also a fantastic example of grassroots impact from research studies. As I close, I bring you back to where I started, my boredom when I sat where you are sitting now. As you wade through trying to understand the very textbook descriptions of research, I would encourage you to keep focusing on what research really is. Problems that we want to address, questions that we want to answer, and differences that we want to make. As you, like me, struggle with paradigms, methodologies and method, and those terrible ontologies and epistemologies, keep coming back to the best method to answer the question. If you had asked me whether I would end up as a researcher back when I was sitting through research methods classes, I would have thought that you were totally mad. I was a nurse and midwife. But hopefully the passion that I now hold for being part of knowledge generation has been conveyed, and whilst you might think it now, many of you will end up hopefully sharing my passion. Thank you so much for listening and have a great time in this subject.